name is Jack Dare. I'm an apprentice nursing associate in February 2022 this year, and I've been working at Bev Hospital for almost a year now. I'm currently on placement on Howard Ward. This is my second placement, but I've also had experience in working on other wards around hospital, including Whitbread Ward, which is a short stay medical ward after A&E and AU. I've also worked on Russell Ward and Isle Whitchurch, which are care of the elderly wards. I've also had a bit of experience on therapy wards, including the Arch unit up in North Wing Hospital. Prior to this, I've been working as a carer at different residential nursing homes for the last couple of years, where I did day shifts and night shifts, long days, short half days, that sort of stuff. And also had a bit of experience in retail and the armed forces. Make sure you have your English, mathematics, science, all that kind of stuff, everything you need to actually complete the course. Every time you're working on the ward, you just learn so much, and all the nurses, all the other TNAs, physiotherapists, everyone's so supportive of you. Like, they really go out of the way to show you how to get things done, what you need to know, what you don't actually need to know. And I really appreciate my time there, and the patients are lovely. The first few months when you start, you will be bombarded with a lot of theory, and at times it can feel quite overwhelming, especially when you're on the ward, when you're trying to figure out what do I actually need to know to complete this course. But I think as time goes by, you do gradually sort of piece things together and just figure it out by yourself. And after that 6-month stage, you'll just sort of get into the groove of things. At a halfway point, I'm sort of leaning towards maybe physiotherapy. That's definitely an aspect of nursing that's caught my attention, but I've also, having spent a lot of time in the vascular ward, I'm thinking of maybe going to theatre at some point in the future as well. Just do it. It's such a rewarding job. I mean, it's a job that really gives your life a sense of purpose. You're actually making a difference to people on a day-to-day basis, and that feeling at the end of a shift is really rewarding. You just learn so much as well, and it's a kind of job where if you don't like one branch of nursing or one ward you're working on, well, the NHS is massive, so you can just go and work somewhere else. There's really no limit to what you can do. And having worked here for nearly a year now, I'm actually surprised by how many other male nurses and TNAs have actually met in the course, so it's really not that bad. Well, we're on our third module at the moment, which is inclusive practice for communication, but we've also done anatomy and physiology, which was fascinating. They do the whole overview of the human body, physiology and anatomy, and the exam at the end, it wasn't actually too bad. And I think that module in particular will be really useful when you're actually working in a ward, because all the theory they teach you, you'll be able to apply it to practice really well. In the first module, IPP, again, there's a lot of stuff in there which might seem quite useless at times, but when you're actually using it in practice, you'll find that actually time management, effective communication, emotional resilience, these are all really useful skills that anyone working in NHS should use on a day-to-day basis.